Again, so are we ready to count down to get live? I think we're ready. You count down? In 3, 2, 1. All right. Good afternoon, everyone. My name is Karolina Mackiewicz. I'm the Innovation Director at the ECH Alliance, the Global Health Connector, and it's my pleasure to welcome you all here, but also online, joining from different parts of Europe and maybe the world to celebrate with us the launch of the xShare project, another big milestone in the development of the interoperability of the health data in the EU, and this is actually the triple celebration because we also have the representatives of the XpanDH projects and Xt-EHR with us. And with this, I would like to, all right. I think this is not exactly those slides that I would like to receive. Can I get the slides where I wanted to show you the agenda? So generally what will happen today, what will happen during this next 1.5 hours, we will tell you a bit about what the xShare is, why it's important, why it's significant, why it makes sense for all of us, for different organizations engaged, like 40 organizations being engaged in xShare, and why we want to actually celebrate this as the big milestone in the development of the European Electronic Health Record Exchange Format. So we have the representatives of the coordination team. We also have the representatives of the different partners, technology partners, the trade association, and our colleagues from the XpanDH and Xt-EHR, and then we will also hear from the adoption side. So in xShare, we have number of adoption sites coming from different parts of Europe, and we also have the SMEs engaged, and we have many of them with us here today. So we will hear. You can see around for those of you in the room, a number of posters and posters of the projects and posters of the adoption site, so you can learn more. I noticed that we're all hot. It's pretty warm in this room, and just please note that we notified the hotel about this, and we are working on this. So please bear with us, get the drinks, and yeah. So this is the consortium of xShare. You see a lot of different organizations, the really reputable big organizations, the academic organization, the standard organizations, trade organization, enablers. So as I said, many of them will speak today. Please remember this picture and connect with any of them. And with this, I would like to then ask Mia Mathiesen from Medcom, xShare coordinator, to tell us a bit more about the vision of this project.
Okay. Thank you, Karolina. I think this fell off. I hope you can hear me still. Thank you for the introduction and for the work you put into planning this event. Also, together with MindView, made a huge effort to make this happen. I'm Mia Mathiesen from Medcom. As you said, I'm the project coordinator of xShare project, together with Catherine, who's the scientific coordinator. It's a pleasure for me to be here today and sit next to these pioneers and experts within standardization, e-health, even the exchange format. I'm confident that with this great consortium and standing on the shoulders of projects and initiatives like the XPAND project and the Xt-EHR, that we will succeed in meeting the vision of the European health data space and release data to the citizens of Europe and help share it with the help of the yellow button. One of the strengths of this project is that we have the key standardization organizations on board. We also have leading industry partners who can help take this to market and make it a reality. But this project wouldn't be anything without the visionary Catherine Konaki, force of nature, driving force of the project. So I'll leave the word to you.
So first of all, the button is the idea of Enrique Martins at the end. he actually was the one that thought about us doing it in the preparation meeting. But where is Luke Nicholas? Luke Nicholas from Etel actually painted the button yellow. He said that we should have a button that looks like the buttercup, because the buttercup has nice pharmaceutical properties. But in any case, no matter what the color of the button is, we are having a bet here. And the bet is that everyone can share their health data in the European Electronic Health Record Exchange Format with the click of the button. That's our vision, that's our bet, and we bet that if we have the leadership of trade associations like Digital Europe, MedTech Europe, and UCROF, we can actually make it happen by supporting them as SDOs. So 6 SDOs, SEN, HR7, SNOMED CT, IAT Europe, IEEE, and CDISC are coming together under the hub, the Electronic Health Record Exchange Format hub, the policy and standards hub, because you need both standards and policy to make it happen. Because we don't think that this is a one-off effort, we want this to be sustainable, and we want to be able to work together with adoption sites, and we have 8 of them, and make it happen. The other thing is we need the governments. That's why we are partnering with the Global Digital Health Partnership. And we need the adoption sites. Yeah, that's why we have 8 of them that are quite committed, as you see the posters around. We have also SMEs that are committed, because there are some posters of SMEs as well, if you look around you. So we would like to win this bet, but we cannot win it alone. We can only win it with the industry and with the governments, because it's not only top-down, it's not only one little isolated thing, it's about xShare, committing to that and making it happen. I'd like to stop here and give the floor to Alexia.
I think it's Deepak, right?
Oh,
Yes.
Deepak. Oh.
Yes, thank you so much, me and Catherine, for bringing us to the world of xShare. And before we move to another people in the room, we would like to also hear from Deepak Kalra from the IHD, who cannot be with us today, but he sent us his video greetings, and he, in the very short video, he presents the vision for xShare, what actually xShare can do, what kind of change maker it can be. And here in the room we are raising the max or glasses for the xShare for the launch of the project. So I think, are we ready with video from Deepak? Yes.
Although you know me as Dr. Kalra, I am a patient myself as well. I have a raised eye pressure and take drops every day to lower this pressure and protect my sight. I must never miss a dose every morning. Yesterday afternoon I saw my eye specialist, who added a second eye drop to my prescription as she felt the pressure is not low enough. This evening I will fly to Athens for a project meeting. I would like to be confident that I have a record of my 2 eye drops in case I lose a bottle and need to obtain a replacement from a Greek physician. I wish I had a patient summary app on my phone which could download my new updated summary. I would have this in my pocket, and actually on my watch, in a format that I could share if needed with any local GP. This would give me confidence when travelling and hopefully keep me safer.
The message from Deepak, and in few words, presenting the grand vision for this 3-year project that started on the 1st of December and will go on for the next 36 months with those 40 partners that I mentioned. I also mentioned that we have the different partners with us and representing different perspectives, and as xShare also want to present the relevance for the industry and develop the xShare label. I would like then to Alexia Papadino from Digital Europe to tell us a bit more about the work in that area.
Thank you very much. It's working. So good afternoon. So I'm Alexia Papadimitriou from Digital Europe. I'm very happy to introduce the xShare label initiative. This label will be featured on national health portals and patient apps, allowing individuals to access and manage health data in line with the European Health Record Exchange Format. In other words, the xShare label allows people to easily exchange data between different health applications. According to the 2023 Digital Economy and Society Index, we've reached a significant milestone of 71% EU citizens having access to e-health records. Now, as we move forward with ambitious targets set by Europe's Digital Decade Policy Programme, which is to provide 100% key public services online by 2030, it becomes increasingly clear that ensuring interoperability is more important than ever. The xShare label is our commitment to compliance. It ensures that systems adhere strictly to the European Health Data Space Regulation. Aligning within the European Commission standards, the consortium will establish this label as a trusted symbol for organizations and citizens, signifying their dataset compliance with the European Health Record Exchange Format. Through use cases, the xShare consortium will examine the label's viability and its practical implication on healthcare manufacturers and service providers. This piloting is vital for adoption across the industry. Representing the interest of 40,000 European SMEs and key players in the medtech, pharmaceutical, and health tech sector, Digital Europe is at the forefront gathering industry perspective for this label. Now we invite healthcare providers, companies, and policymakers. Join us in embracing the xShare project. Be part of the project. Together we can forge a connected and efficient digital health future for Europe. Thank you.
Thank you so much, Alexia. And maybe about this joining us, how many of you here in the room represent the partner of the xShare? All right. Okay, I would say 50-50. So for those who don't represent the partner organization, and also for those who do, please follow us on social media. We have the group and also the page on LinkedIn and also on X, so you can always be informed about the events and about the developments around the project and the progress. And we also plan to launch the Community of Excellence, so we will definitely look for people who want to be closer to the project and want to also give their, as we are all opinionated people and want to always share what we know and our experience. So we invite you to bring your opinions to the table through the Community of Excellence. So you will learn a bit more about that from our communication. So with this, I would like then to move further to deep digger into the significance of xShare and invite Robert Stigwy from CNTC 251 to give his contribution and perspective on the project. Why this project matter?
Yes, thank you, Carolina. And it's an honor to be here on stage with such distinguished colleagues in the digital health world. And we do understand that society really needs digitally transformed health services to be operationalized, to be implemented, to be delivered to the workforce, to the citizens, to the patients, in order to actually face the challenges that all health systems across Europe and probably around the world are facing in terms of the amount of work and the amount of need for services that are. Those initiatives really need to pick up from the ground. They need to be realized at the point of care, but they need to scale. If a patient goes somewhere else, they don't need to redo everything. They need to follow up where the other provider left off. And that needs to scale nationally, that needs to scale across borders. And that's the vision of the European Commission already for quite some years. And as SDOs, as standards developing organizations, we really want to support that vision with standards, with interoperability, with the ability to actually make this happen through the European Health Record Exchange Format. I think I've lost my sound. No?
No.
Okay, good. So that's what we're doing. And you already saw in the pictures that there will be an electronic health record exchange format standards and policy hub in which the SDOs work together with the governments and the regulators and with the industry to actually make sure that we have a common ground to have these discussions, to come to agreements, to actually provide the services, to actually implement this, scale this at the local, regional, national, and cross-border level. That's what we're there for. And we don't want to have solutions siloed either in countries or in regions or on topics or whatever. That's what we've learned over the last, I think, 15 years of working together also globally within the Joint Initiative Council. We need to work together to provide solutions that support this important transformation of health and care. That's what the hub is all about. It will be there not just for the xShare project, because these questions will remain there after the project ends, and it would be a loss of investment and money and effort if we were to just end the project and say, well, this was the hub and that was it. So we intend to actually establish this standards and policy hub for the electronic health record exchange format next year as a permanent entity, with the support of the industry, with the support of the European Commission, with the support of the national governments, other regulators, and e-health expertise centers, because we feel that we need to continue to work together to make this happen. And that's why I'm very proud and excited to be on this xShare project with the major standards developing organizations, with the support of key players in industry and in the government, and I really look forward to take forward the work that XpanDH has been doing, because we are building on and relying on the work that Enrique and his team have been doing, and also working together with my neighbor Christos to actually work together with the Xt-EHR joint action to actually have that collaboration with the governments, with the regulators and the European Commission to actually make the European health data space a reality. That's what we're here for. That won't happen in 3 years' time, so we really need to invest now to make that a reality over the course of the next years. Thank you.
Intervention. Okay, cheers, and let's raise the glasses for Max. Thank you. Yeah, it's definitely a joyful moment here, and we also send the greetings to everyone who is watching us online, and hopefully you can cheer with coffee or tea or other drink. So now we heard about the vision of the project, about its significance, and we will now zoom out a bit. Like, we will now see how this project actually is positioned within the other activities in the sphere. Of course, as you are aware, it's not the only project that works on electronic health records exchange format. There are also other activities done on the level of the European Union and then realized through the projects like XpanDH and Xt-EHR. So before giving the floor to Henrik and Christos, who represent those projects, we also invited the European Commission to give us some greetings and some guidance. And this person, who you will see on the screen, does not need introduction. He was already with us today on several occasions, Konstantin Hyponen from the European Commission. So if I may get the video. Thank you.
Dear representatives of the xShare project, dear organizers of the Athens Digital Health Week, distinguished guests, I wish to congratulate you on the launch of this important project selected for funding from the Horizon Europe cluster. I come from the Digital Policy Service of the Commission, DG Connect, representing the so-called policy owner of your project. We in the Commission are closely collaborating among the services in charge of technologies and public health to facilitate steering and consolidation of various ongoing actions in this field. Therefore, I would like to emphasize a few points for you to take into account from day one of your project. XShare has put together an ambitious work plan with many activities related to the use of the European Electronic Health Record Exchange Format, or as we can simply call it, the format. As many of you know, in last December, we organized together with the XpanDH project an expert summit on the format, gathering together a large range of stakeholders. There it became evident that several other projects are already working on the format and with the format. So the interest is clear across the full landscape of healthcare provision, and one of the reasons for this is the format's envisaged role in the upcoming European Health Data Space Regulation. XShare operates primarily on the innovation and experimentation of the format. We know that building evidence will pave the way for wider acceptance and adoption of the format and of the services it will support. Therefore, evidence generation is needed in what works, for whom, in what circumstances, and also why. Your contribution to the joint action Xt-EHR will be very meaningful, so that the formalized format specifications will not only be approved as fit for purpose, but widely endorsed as fit for practice. Considering this, my first point relates to the importance of avoiding overlaps with other ongoing and past projects and activities. It can be fully expected that the project participants will have ideas and useful input related to the development of the format. You are thus very welcome to liaise with and feed any such work into the joint action of member states, Xt-EHR, funded from the EU for Health program, in charge of developing the formal specifications of the format. But no overlapping work will be tolerated, as we can never allow double funding. Given the busy landscape with many projects contributing to the upcoming EHDS regulation, my second point is the following. Please use and build on what is available as results of the ongoing or past projects. To give you just one example, I would like to mention the concluded project, Interoperate, funded from the Horizon 2020 research program. This project has already performed pilots of a similar functionality and data portability model as the one envisaged by XShare, namely the XShare button. I encourage you to take a good look at the results of that project, Interoperate. Having said that, the development of the XShare button and associated data portability are indeed very relevant. Deployment in different settings, such as by national authorities or at the level of hospitals, is needed. In fact, the possibility to download electronic health data and to have it accepted elsewhere is a right for natural persons envisaged in the upcoming EHDS regulation. In addition to downloads, there is also the upload, the data acceptance functionality, and both the download and reuse components are fundamental. Therefore, my third and last point for today is to invite you to pay special attention to the reuse or upload or share functionality of the portability toolset. Data sharing should be made easy for patients. Data acceptance should be made easy for health professionals, and data portability in a patient-mediated way must be useful for both parties. To conclude, I want to thank everyone here today for all your efforts towards the implementation of the EHDS. We are making great leaps together. This progress is much needed by the whole society, by all European citizens. So let's keep the society and citizens in mind in every endeavor. Thank you.
Big thanks to the European Commission for giving us the chance to do this project and also supporting the project, and great words from Konstantin to put those pieces together. Yes, xShare is one of the puzzle on this map, and as I said, we would like to then hear a bit more from those two other puzzles present in the room. So I would like to give the floor to Henrik Martins, who is the professor at ISTE, but also coordinator of XpanDH and also partner of xShare, right? So you have different perspectives that you can share with us here.
Yeah, thank you. Thank you very much. I think people are still resonating the message of the Commission, so I have to allow some digestion time. Otherwise, no one pays attention to what I have to say. Anyway, very happy to be in this launch event of xShare. Thanks, Catherine, for the attribution of some early ideas on this. But anyway, let me first talk about XpanDH and then a little bit on our role also in xShare and how we see this coming role. A few years ago, long time ago, I know Catherine has some surprise ready, but I'm not going to destroy the surprise, Catherine. But just allow me to tell you why the word XpanDH came from, okay, because it might be useful. So some time ago, there was a project called EPSOS, which maybe you've heard about, and it was coming towards the end, although a nice Swedish good friend, she's in the room somewhere, Anna, raise your hand. Somewhere she is. Anyway, she was extending it for another 6 months so that we could finally pilot something. And there was a need to come up with what was called at the time a thematic network. It wasn't called the Common Support Action, Coordination Support Action. And a few ladies, okay, whose names I'm not going to be extensive about, but one is in the room, Zoe Kolitsky and Michel Tonnet from France, and I think, Catherine, you were behind the scenes as well. They said, why don't we ask this young guy, you know? At the time I was young, of course. I'm still quite young, but anyway, I was young in the scene, you know, in this sort of interoperability scene, you know. And I had never coordinated anything, but I was one of the very vocal guy from the Ministry of Health and whatnot. Why don't you coordinate? And then I said, what's the problem? So the problem is that we need to, you know, make this happen. And, you know, it can't be just a few participants. We need to move this. And the challenge at the time was to hand over to the European Commission in a thing called CEF, Connecting European Facility, legislation and funding, the assets, a name that is now well established, the interoperability assets that had been developed so hard in EPSOS. So okay, we have to expand it to the Commission, and that was where the name comes from. We have to expand the ecosystem, because it's always the same people in the room. And I hate the fact that it's always the same people in the room. So the first thing I want to congratulate xShare is that it has brought new partners. Some of the partners in xShare have never been in this type of projects, and that is a very good, because, you know, it's always good to meet new people. You know, the old people, you know, not so fun. Anyway, that's for me, at least. Second point, we had to hand over. And the funny thing was that now XpanDH was also in the same process. There was some assets from xEHealth, 3 new domains, that have to be handed over to my good friend right next to me. Now, this means that we have evolved. We are not handing over to 2 guys in the Commission, whose names I'm not going to say, but one is a good friend, Licinio Mano. We now have to hand over to the Commission and to 27 plus 1 member states that are now ready to receive. Because at the time of 2015-16, there was very few countries willing to receive the challenge of connecting and opening their data through standards. So I'm really privileged to participate in this handing over. I'm really happy that our project is only 2 years, and it's now on the down curve. It's now the time to thank Anderson for all his work. Everything we do is 1% inspiration and 99% perspiration. Both parts are Anderson's, okay? Final comment on XShare and our positioning. We found that training and education is now the missing piece. The ecosystem is interested. The ecosystem is heterogeneously getting motivated. Some partners are very active. They go to websites, they go to webinars. We've done a lot. Carolina, thanks for all of that. But what we notice is that many companies don't know what they have to do. When we talk with hospitals, finally we have fire, hospitals on fire, and other initiatives on fire, and healthcare communities on fire. But I think we now have to focus on capacity building. So our main contribution as partners is in the work package related to capacity building. And one would ask, well, if we don't have the standards yet defined, the Implementation Act is not yet published, the regulation is not even yet approved, why are you so worried with capacity building? Because now we need time to prepare. So Maniji, which has its own meetings here also this week, is one of the first masters built out of 4 universities around Europe to build capacity. Xt-EHR is part of that project. We're also trying with HL7 Europe launch an Erasmus call just focusing on capacity building for the exchange format. We didn't win it last year, but we will win it this year. And if we don't, we will try again and try again and try again until we win it. So that's my final word, capacity building, because once it's published, then everyone has to implement it. And this is now the challenge. Final thing I want to say, I see tension between the consolidation, someone called it freezing the standards in implementing acts, and the innovative, open, shareable, and bubbling spirit of XShare. And I think these should not be contradictory forces. But this balancing act is, I think, what's going to be more fun in the next coming 3 years.
All right, cheers to that. Thank you so much, Henrik, for presenting the XpanDH and adding also to this, building the whole picture and the environment in which XShare is operating. And then last but not least, for this part of this event, we would like to hear from Christos Schizas, who is from the National eHealth Authority of Cyprus and coordinator of the Xt-EHR. And we already heard this name of this project from number of times. So this is the joint action, so on the different level, right? On the level of the member states. So another piece, another level, another layer of this puzzle. So Christos, can we hear from you a bit about your project and also how this links to the XShare and what's your message to XShare is?
Yes.
Thank
you, Carolina. I got a bit of a surprise I couldn't prepare anything because I wanted to hear what the predecessors had to say and continue from that. You see that chair there is nobody, so I don't have to pass to anybody. Everybody from EPSOS, etc., Expand, they all said we give it to extended EHR to deliver. So we don't have anybody to pass the word. So we have to deliver, and we have about 33 months to complete this project and deliver to the Commission. I heard again very carefully the words from Konstantin Hapunen from the Commission, who has been very, very instrumental in preparing this project, in preparing the idea and the timelines for actually delivering something. We say we talk about scenario, we talk about what is going to happen in the future, how we serve the citizens, but unless we satisfy ideas such as the one Carla scenarios came up to us today, we will not finish, and we have to run fast. Therefore, we have I would say, very good consortium with all 20 members participating actively in this, some more, some less. But I am quite happy that we all have taken seriously this duty. We didn't have the luxury, like xShare had, to choose their partners. This is usually the case, you choose. We inherit the partners, are the competent authorities from each country. Whether you like it or not, this is what you have to do. But we are lucky that these partners are quite serious, and they are collaborating, very hardworking, because we have some driving forces, some key elements in the consortium that remind us, the quiet ones that do the most of the serious work. We have those that remind us every step where we're moving, like Marcelo is always there to say and prevent us from doing things. We have Andreas, who is always there to help with the members of the consortium, and also from the Commission. Great help from Hadea and Maren Hans and Leah Martina, and also mentioned Konstantin before, that they are there to help, and Kyriakos. And I think we're going to deliver on time what my friend mentioned before, and with the expectations of the Commission. What do we have to do with xShare? In xShare, we have a small role, but a very challenging role. We are one of the adoption sites. We head to that, and my team tells me that they want tomorrow to demonstrate real live the project. So Konstantinos Batikis, he assured me that tomorrow you have a demonstration of the blue button. Of a button.
Some sort of button.
Some sort of button. So these are promises to do. And having said this, I would like to thank very much Katerina Chronaki for giving us this opportunity, and her enthusiasm is a guarantee that xShare will deliver. Thank you.
Thank you so much. So we're definitely now warm up. I think the temperature in this room is improving, but at the same time, the emotions are raising. So this is the end of the first part of our event. So let me join me in the round of applause to our distinguished speakers. And while I will let them go and take the seats, take a drink, I would like to let you know what will happen next. So we also want to hear from the adoption sites. As you see on the slide, we have a number of adoption slides. Christos has already said something about Cyprus, but we will give each of the adoption side the opportunity to, a representative of the adoption side, the opportunity to come to the stage and tell us why they decided to join this journey, this really absolutely revolutionary journey. As Henrik said, we need new players, and many of those adoption sites guys are the new players, I think, and brave enough to really take on this role. So thanks to this, yes? Yes, we can take the photograph. I already also took. So quick, can we get the photo, Dimitris? If you can take a photo. But please don't, get more water and what you need, and then we continue. So all our adoption sites can get ready. Should I join you?
Yes.
Yes.
We leave the podium, right?
We leave the podium after we take the picture. Yes? Okay. Thank you so much. So then if we can get ready. I think our first brave adoption site, okay? Just a second. May I have your attention, please, still? Okay. Okay, 1 minute of pictures, but then if we... All right, thank you so much. May I get you back to the room? No, it's my company. Yes. All right, adoption sites. So we have the number of the adoption sites, people, organizations, regions that will actually test the... Can I get back of the room? I'm very happy that you have lots of topics to discuss, but we have... Yes, okay. Hi, are you from... no, then you're not yet Irish. Okay. We would like to start with Italy.
We're very enthusiastic.
Okay, so Ireland very enthusiastic, but we wanted to start with but I like Italy. So if I may... No, you will stand here. So Stefano Dalmiani, right? Yeah. You, okay.
Monasterio Foundation is a public research hospital active in medical and technological field. Monasterio is a healthcare provider of the Tuscany region public service, having the highest specialization in cardiopulmonary diseases, with 2 facilities located in Pisa and Massa in the Tuscany region of Italy. Monasterio has over 25 years of experience in developing electronic health records and is currently the EHR solution provider for the entire healthcare service of the Tuscany region, supporting 4 million people. Since 2000, the EHR system interoperability is one of the main pillars established in Monasterio. Many standards have been tested in Monasterio facilities as early adopter, leading to innovative healthcare processes supported by a pervasive presence of IT systems. The exchange of data between healthcare professionals and the collection of data for medical research were the initial goal in the early 2000s. But with the widespread of smart mobile devices in patients and caregivers, new scenarios and new possibilities for direct exchange of data with the patients and caregivers were possible. In the last 10 years, Monasterio worked on data sharing with patients using innovative approaches and application scenarios, considering also issues coming from the application of the latest regulations and local policies. In the last European project, Interoperate, Monasterio was responsible of the experimentation of the exchange of clinical data directly with the patients and their smartphones, using FHIR protocol and tested in hospitals of different countries. In xShare project, Monasterio aims to develop and validate the xShare button in its EHR system. The xShare button implements the European EHR Exchange Format to support patient-centered exchange of health data and medical records between patients and healthcare professionals, supporting at the same time researchers and medical research through data donation and the full control of the personal data. Monasterio Foundation, healing by research.
So I would like to thank you for the attention, first of all, for our greatest video that we produce in a few minutes, just to add the final part related to the xShare. So you are really far ahead of time because you already anticipated the comments from the European Commission, because you already involved somebody that were the supports of demonstrator for the Interoperate project. And essentially, the Interoperate project brings some experience into this, because already implemented essentially the same functionality that the yellow button or whatever color button you will use to download information, basically transferring information from the hospital EHR to the mobile app of the patient. But we didn't implement the download on a single file for the mobile app of the patient. So this makes sense to be implemented in xShare. So we can contribute in xShare also for the, let me say, local part of allow a direct consultation of EHR data. This is a direct application of the Article 20 of GDPR. But we are also interested in contributing in our approach to research, because in Interoperate as well, we implemented the usage of the EHR data also for research, directly used extracting data from the patient's smartphone. And this is an essential way to involve patients in their, empowerment and usage of data for the patient, data donation support essentially. So this is our approach, and this is what we intend to do in the xShare project. So I'd like to thank the organizers, first of all, and then all the contributors for this great project. Thank you.
Thank you, Stefano. Thank you, Stefano. And the next is Carla Alvarez from Spain, from Catalonia. I will maybe sit here.
Hello everyone, I'm Carla, representing Fundació TIC Salut Social, a public entity within the Ministry of Health of the Catalan government. TIC Salut is proud to represent the Catalan region in xShare project. Catalonia, with a population of 7.8 million citizens, is dedicated to advancing the digital portability of health data based on international standards. Our goal is to empower citizens, allowing them immediate, easy, and free control over their health data in an electronic, structured, and reusable format. The xShare project is a transformative initiative that will redefine the European healthcare scenario. It empowers individuals to securely access and download their clinical data in a structured format. This pioneer effort establishes new standards, facilitating the exchange of medical information across borders, overcoming language barriers, and ensuring efficient, patient-centric healthcare services through collaboration with multiple European nations. It marks a significant stride towards realizing the European health data space vision, embracing the principles of data accessibility, privacy, and interoperability. Moreover, xShare will facilitate the exchange of data in various compelling use cases, such as collaboration with the private sector, secondary use for research purposes, and health tourism. We are thrilled to be part of the xShare consortium and eagerly anticipate sharing the results with the European community. Thank you very much.
Thank you so much. Thanks to Catalonia. And the next one, I will ask Andrea Pimenta from Madeira. And while we are waiting for Andrea to come to the stage, there was a question in the chat. How many Europeans will be covered approximately by our validation of the... Catherine is counting, Robert are calculating. All right, so maybe from each of the adoption site can also say what's more or less the population that will be covered, will be approached, and then we can do a quick math. Andrea, yeah.
I speak first. Yeah. Hello, everyone. I think there's a small fire beginning at the back. Now I think I have your attention. working in the Ministry of Health and Civil Protection, I know how to draw people's attention. So, my name is André Pimenta. I'm here representing the government of Madeira Island that works and is present in this project as well. I have a statement, a small video from the Ministry of Health, and he can also explain a little bit better how and what we intend to do within xShare. Please.
Since 2021, May 2021, when we start the Madeira Digital Health and Wellbeing, I could say that this is the most important project for the digital transformation that we are beginning in our government, in our island, in our health system. The 4 projects that belongs to the digital health and well-being, the ICU for COVID, the Smart Bear, the Smart for Health, and the Quality Chain. They are 4 projects that since 2 years from 2021 help us a lot in our health system. And the Smart for Health relating with the creation, the possibility of creation a data center here in Madeira, where all the files of the citizens from Madeira and the one that visit us can be registered, and if they have any problem here in Madeira during their stay, they could be followed with security and quality by our health professionals. The opportunity to investigate this data, to analyze this data, and to, with the conclusion, have the opportunity to change some of the treatments, some of the imagiology that we are using in our patients, in our diagnosis, could help us to have a better decision making in the health system.
Can I speak a little bit more? So this project goes totally in line with our digital transformation within Madeira Health System. I invite you to check our roll-up if you want to learn about more about us, and also to speak to me if you want to. Thank you.
Perfect. Thank you so much. I think all of our partners will be here until Friday, so we have great opportunity to check. And yeah, we have the posters ready. Yes? 250,000 in Madeira. All right. We're starting calculating. And now we move back to Greece. So I would like to invite Elpida Fatiaudou to tell us a bit more about the adoption site here. Yeah. Please.
Good evening. I'm Elpida Fatiaudou, I work at EDICA. EDICA is the national contact point for e-health and operates all the national health systems. We're very happy to participate to the xShare project, and also we were very happy to host the xShare kickoff here in Greece. We made the first step 2 years ago with a mobile app for citizens where they can have access to all their health data, e-prescriptions, lab results, discharge letters, medical certificates, and medical appointments, etc., vaccination for their children. And our aspiration is, the second step is to put the yellow button to the mobile app, My Health. All here in Greece, I think in every country, citizens, health professionals, innovation and research organizations and third-party apps are very eager for all these data. Thank you very much.
Thank you so much. And how many people you cover, Fiona? How many people you will cover? How many people you will reach?
All the population in Greece, about
11 million. Okay, so we have 250,000 and 11 million. That's an easy math. And then we moved to Ireland. Our colleagues from Ireland were here at the beginning, so we give the stage to Patrick and Eamon.
Good afternoon, colleagues. Just to say it's a privilege for Ireland to be here and participate in the xShare project. My name is Eamon Coyne, and I'm joined by my colleague from the Health Service Executive, Patrick Marin, and in the crowd we have our colleague, Katrina Ray. So I work in the Ministry of Health, Ireland. As Henrika mentioned earlier, the EPSOS project ran for a number of years, and unfortunately Ireland didn't participate. So ever since that, we were playing catch-up in relation to the European work. But once we started to get involved, we knew that we were joining the European health family in terms of interoperability, digital healthcare for European citizens. So we bought into the vision strong and hard. So we're quite heavily involved, the Department of Health in Ireland and the Health Service Executive, in a number of different European initiatives. So we believe in the vision, we're committed to the vision, and we joined the xShare project because recently we have revisited our eHealth strategy, and at the eHealth strategy, the patient centricity, citizen centricity, digital literacy is at the core of that. So the xShare functionality, expanding our My Health at EU implementation to encompass patient access is critical to the delivery of those services. So we believe in that. We have a patient advocacy group within Ireland called IPOSI. They recently ran a citizens' jury, and Irish citizens are ready for access to their digital healthcare records. They want to be empowered to have access and control over that. So we're committed at the policy level at the Department of Health. I worked previously with my colleague Patrick on the operational side in the Health Service Executive, and he's the technical lead for the OpenNCP implementation. So we're fully committed. We're looking forward to working with all of our partners, all the collaborators, because we believe in this vision and we're excited about it. Ireland has a population of 5.5 million. I see Catherine raising the glass there. I've said enough, so I'll pass to my colleague Patrick just to talk about the operational side.
Yeah, thank you, Eamon. I work for the Health Service Executive here in Ireland, with a population of 5.5 million. We operate all the public hospitals. We're fully responsible for the public health service. And we have a huge focus on, we're very patient-centric. So what we actually see is, as Europe moves towards the 2030 vision of empowering MyHealth.eu and patient-centric, we believe this xShare project is hugely important because it's going to empower the citizens to take responsibility for their own health and not just sharing information, but making sure that that information is up to date and adding information where they self-administer medication as well. So it's very important for the Irish citizen to get on board on this project, and over the next 3 years to start using that button and sharing that information with our health professionals and improving the overall health population within Ireland and with the EU perspective. So thank you, and we're really looking forward to working on the project. Thank you.
Yeah, and thank you to the colleagues for the hosting and Greece for such a wonderful venue. And as Marcello Malgaro says, the most important part of interoperability is the human interoperability. So enjoy each other's companies this week. Yeah.
For sure. Thank you so much. Yeah, for sure there is some connections going on, discussions, but I still need a couple of minutes of your attention as we still have some people who would like to share their story with us, and then we can go to party. And now I'm looking, and I know he should be here, Morten from Denmark. Is Morten Brun Rasmussen with us? Yes, Morten is here. So we have the last story from the country, so the Denmark, and then we will also hear from the representatives of the SMEs. So Morten, yeah.
Yes. Hello, good evening. My name is Morten Brun Rasmussen. I'm coming from Denmark. I am partner in xShare, coming from a consultancy company called Medic. I am working very close together with Medcom, which are the coordinator, and also the Danish Health Data Authority. In the past 3 years, we have been working very much on a new e-health service for sharing care plans. We will go live here in 2024 for sharing care plans from GPs, for COPD, for diabetics and for heart diseases. Here in xShare, we will use the opportunity to do reverse engineering and see how we can do the whole process from the ID to national deployment and to specify it in the exchange format. We have actually the problem today when you're coming up with new services, new IDs, from the ID until it is fully deployed in a small country in Denmark with 5-6 million inhabitants, it takes too long time. We can't wait for this. We hope that the xShare, we can give some input how to improve and speed up the process, and we hope also that we can learn. Thank you.
Thank you, and apologies, I was too fast, so I didn't cover the whole geography of Europe. We come back to neighboring Cyprus, and already Christos gave us a bit of hint that Cyprus is also an adoption site, but we have here two colleagues that will, oh, okay, more colleagues.
Thanks a lot,
That
yeah.
will, but you told me 2 minutes.
2 minutes.
2 minutes.
2 minutes.
All right, you have 2 minutes.
Thanks a lot. The National E-Health Authority is the competent authority, and University of Cyprus is an affiliated. We are very proud that we participate in xShare. And actually, let's share. We are pleased to demonstrate the FHIR Smart Health Link. It's the first implementation in Europe. So I will give the floor to Konstantinos to say a few words, and then we have Christian and Theodoros.
Hello all, good afternoon. I will be short. So today my team from the University of Cyprus will present you our solution for Smart Health Links. Our solution is around the patient, and we wanted to find a very easy way for the patient to share his international patient summary information with his doctor. Our solution is based on Smart Health Links and on safety standards, and all the data are controlled by the patient and only by the patient with a secure way. So my colleagues, Christian and Theodoros, will do you a live demo. And yeah.
Hello everyone. I will give you a short demo of our application right now. So as you can see, this is our homepage, and we'll go to the Smart Health Links. Here, we give the opportunity to the user to create a new Smart Health Link by pressing the Create button. During the creation, we get the patient summary from our service, and we create the resources that you can see here visualized, and we present 4 information. First, the type, then the most important information, and 2 more information regarding each category. For example, in allergies, we have the category and the criticality of the allergy. By default, all resources are selected to be shared. However, the user can unselect them all. And for example, he can choose a category to share. Let's say we want to share all our allergies. So we press at the allergies. We only show our allergies. We will select every allergy to share with our clinician. And also we can search specific allergies if we want them only to share those. So let's press continue. Here is the confirmation page where we say to the patient that you have selected these 3 resources. It can be more or fewer. Do you wish to proceed? If he did by mistake select an allergy that he does not want to share, he can just unselect it and it is removed. So by pressing continue, it requires a passcode. In our case, we will use 126. And the label is just a name for the user to remember his link if he wants. By default, the name is the link generated on date today. Also, we have an expiration time for the link. Let's say that it's for a day. And then we just press create. The link was created. And as we can see, it's I think it's this one.
Should be the last one.
Let's see. Yeah, it's this one. Here you can scan it right now, whoever likes, and he will be redirected in our front-end web page, where he can visualize this information that the user selected for the patient. I will also share it via email to my colleague in order to show it to here. So, for example, you will send it to your doctor. There is already an email here. So we press send. You can still scan it if you want. And also, the user can copy the link, or it can also open it via his smartphone. Okay, I will go from here. So, when the receiver of the QR code wants to access the link, yes, correct. I see already few successful few successes. So yes, here I insert the correct passcode. And when we press continue, we can see that those are the selected resources the patient have seen. And lastly, yes. And you can also view how many people, sorry. I think it's this. You can see that, yeah. Thank you very much.
Thank you very much.
You need an XShare button here.
Thank you.
Well done.
Okay, wow, okay. Someone did their homework already, so, got the star students. Thank you so much. Not an easy task to still keep us all focused, but I would like to thank you so much and ask for a couple of more minutes. We will now hear from at least two companies. If the third company, if Data Wizard is with us, please make yourself visible to me. But first, I would like to invite Alexander Berler from Gnomon to tell us a couple of words about why Gnomon is engaged in xShare. Can I ask the rest of the room for a couple of minutes of attention for Alexander and for xShare? Thank you.
So, thank you very much. It's a great event and a great launch. So it will be a journey of 36 months, right? 35, right. So Gnomon is in the domain for a very long time, since EPSOS times. It's part of the group that created the OpenNCP software. So we know the drill, we know how it works, and we hope to contribute again in the same exact process, create open tools that can be distributed, because if you don't have tools that can be reused, you don't have a market. So that's the basic idea, and that's the basic idea why Gnomon is involved in this process, to create a market that will create revenue for the wider community and, of course, for Gnomon. So in xShare, Gnomon has the important task of creating the implementation part of the yellow xShare button, alongside with our other colleagues, and we hope to be successful in that. And we really are glad to be here and contribute to this very interesting journey, shaping the future of Europe. Thank you very much.
Thank you so much. And last but not least, and I would like to invite Ioannis from TTSA to share his view and perspective and expectations.
Hello, everybody. My name is Ioannis Matsakis. I am here as a representative of the European CRO Federation, EEHRxF, as well as of my company, Telemedicine Technologies. I am a member of the executive board of EUCROF since now 10 years. And I'm very much happy to see that for the first time, probably, we have a real connection between the healthcare system and clinical research. I think it's a first which is really achieved in this project. EUCROF is representing 31 countries. It's a federation of national associations. Here in Greece, we have HACRO, the Hellenic CRO Association. Lia Koraki, who is leading this association, was supposed to be here tonight, but she's been invited or called to go to the ministry for some important matter, and she couldn't come with us. EUCROF is representing more than 450 companies across Europe. 90% of those companies, they are SMEs. 30 to 35% they are IT vendors specialized in the clinical research. So they are delivering IT tools which are used for the purpose of clinical research by all the stakeholders. As a not-for-profit, and last but not least, EUCROF is representing those companies. They are representing something like 30,000 colleagues. Clinical research in Europe is currently, as we are speaking, there are more than 28,000 clinical trials and clinical studies running in Europe. And over the last period of 5 years, we had more than 2 million of patients getting advantage of or contributing to clinical research. And in many cases, this has been a unique chance for them to find a cure to their disease. Not only helping for other future patients, but also for themselves. And here it is where xShare is going to play an important role, to our view, because in patient recruitment, patient enrollment, this is giving more chances to the patients to find a cure for their, for instance, rare diseases. We know that. And here, the yellow button may be helpful, for instance, in patient pre-selection processes. And we know that pre-selection processes, if we take them, we need data both from the clinical research system and from the care system. So having standards that enable us for a full digital data flow for clinical research is essential. And EUCROF is also taking care of the patient-centric view. We have developed over the last 7 years what we call a code of conduct for data protection in the domain of clinical research. It's next Thursday, 25th of January. This code is going to go to the plenary session of the lead data protection authority for adoption. It will start a final process for adoption that will end in June in the UDPB, the European Data Protection Board. And the focus here is to bring with us all our SMEs to align with very demanding data protection requirements, more than 217 requirements for IT systems in the health sector. And those things will be implemented by our community. And by implementing those things in our community, this impacts the investigational site participants to the clinical research. And EUCROF, as a representative stakeholders, is maintaining a lot of connections with the European Medicines Agency, with various stakeholders of the pharmaceutical industry, the biotech industry, all the academic research centers who are contributing as investigational sites to the clinical research, and with many patient associations. And I can witness here that in many of the stakeholders meeting at the European Medicine Agencies where patients are represented, they are asking for data portability of their data, especially when they are suffering of diseases where research, clinical research, is going to play an essential role. Unfortunately, we don't have tonight with us one of our colleagues from the European Patient Forum, who is also living here in Greece, but he would have said that exactly word, how much it is essential for patients to be able to control their data. And I was very happy to hear what you just said about and some other of our colleagues today, how much it is important for patients to have the control over their data, but this will give us more trust and more efficiency also in the clinical research. Thank you.
Thank you so much. And we actually found our colleague from Data Wizard. So we will still hear from Nicola about their expectations. And after that, we will party. Yes. So yeah, for Nicole.
Hi everyone, I'm Nicole Veggiotti from Data Wizard. I'm a technical project manager. And Data Wizard is one of the first companies in Italy that work on artificial intelligence in the digital health sector and also in patient empowerment. Every day we work with doctors, healthcare professionals, research organizations, universities and companies to improve the digital health sector or to try to improve digital health sector. We have a benchmark platform that is called Pharma Wizard that we use also for Unicom that can connect patients to this project, to xShare. And so I think to quickly wrap up that we can contribute in many aspects of this project and also we can learn many things from xShare. So thank you so much. Cheers.
Thank you so much. So now we have, I think, the full picture of this journey that we are embarking on. 36 months together, 35 months to go. Thank you so much for being such an amazing crowd today. Thank you all for joining us online. The atmosphere in this room is buzzing, so I cannot wait to close this with another cheer to xShare and the whole XpanDH, Xt-EHR, and the whole ecosystem of changemakers that is here in the room and online with us. So thank you so much, and yeah, some announcements.
No. Yes, all the xShare partners come out here to take a picture. It was asked by our colleague Maria. Thank you, Maria.
Thank you so much. Thank you.